All right. Good job. You got it.
What if I told you that you could live in a world where you were happy, you had most of the things that you needed and wanted on a daily basis, you were relaxed, in other words, you didn't feel overly stressed all the time, and you were engaged. You had something meaningful and enjoyable to work on during your days. I bet you would say, yeah, being happy, relaxed, and engaged sounds like a good life to me. That's the life I would want. And in fact, that is the kind of life that many of us are pursuing for ourselves and others on a daily basis. Everything we do at Upstate Caring Partners for our services with people with intellectual and developmental disabilities is focused towards creating a world where they have a chance to be happy, relaxed, and engaged. One of the ways that we do this is to create a higher quality of life for individuals by teaching them practical skills that they will need to be happy and joyful in the world. Skills that support joyful participation in their own interest. Skills that help build meaningful connections to their environment. Skills that help them connect to their families, their caregivers, and in the communities in which they live. When we do this, when we get individuals to a place where they're happy, relaxed, and engaged, we find that most of the time they begin to open up. They begin to want to expand their world, learn new things, and to grow as individuals. Most importantly, they learn to be empowered.
Right now, Dante is the only documented case that has Smith-Magenis syndrome, which is deletion on the 17th chromosome, and DUP15, which is an extra 15th chromosome. I knew he had intrauterine growth restriction before he was born. Because of this, it led to hypotonia, which was low muscle tone. We had early intervention. 5 days a week, sometimes 2 to 3 sessions a day. He ended up being diagnosed with the 2 chromosomal abnormalities and autism.
You're pretty special.
It was very challenging a lot of the times. He's pre-verbal, so he doesn't communicate at all verbally. That was very challenging because he would have outbursts. A lot of times we didn't know what was wrong, why he was getting so upset. I went to world-renowned doctors with him. I traveled all over the United States going to conferences. I really tried to educate myself, and I actually previously looked at 2 other schools, which Dante got denied from both of them. Somebody had recommended UCP to me. They took Dante in right away after a few, we met with a few people, and they were absolutely fantastic about wanting to take Dante into the program.
When I first met Dante, I remember that he didn't really have any social engagement with anybody or social interactions. He didn't initiate interactions, and furthermore, he didn't respond to other people's social interactions very much. His world wasn't expansive and big in terms of a social world. He really kept to himself.
Whenever a student comes into our program or into my classroom specifically, our first order of business is to build our relationship with them. We build our relationship through their interests, their likes. We try to find their reason for doing the things that they do or wanting the things that they want.
So when Dante arrived here, we really focused on his communication because he had no way to get his needs and wants met. And in order to do that, we had to build a trusting relationship that when he communicated, we were going to honor those communication attempts. But because we saw the potential for all the skills that he was capable of, he just needed the right environment to showcase those.
Happy, relaxed, and engaged and rapport building is the foundation that we build skills on here at Upstate Caring Partners, because learning best happens when somebody is in a state of joy or relaxation and when they're engaged with the people or the things that are around them. As I was spending some time with him, I had lifted my hands up to fix my hair, and I immediately saw his face look up and his eyes light up at the sight of my elbows in the air.
Through Dante's fascination of elbows, we've learned to shape a lot of his behaviors that he was having previously when he first came to us, such as running out of the classroom. So we would be proactive in our strategies, and we would give him elbows before he had to ask us for them, so he didn't have to always have a negative behavior to get what he wanted.
We also found out that he was not wearing his glasses as prescribed. And so one of the main goals that we had for him when he arrived here was to get him to tolerate the feeling of his glasses on his face so that he could access more of his environment around him and gain that sensory experience and vision. So slowly, we built up his tolerance where he's wearing them most of the time now.
UCP has opened up Dante's world. He feels very connected, very attuned to the staff, and he is much more open to trying new things. His diet has totally changed. He is very motivated by the people that help to educate him and to his peers in the classroom.
You take a seat.
Well, it all started when I was little, and my cousin took his dart out, old dart, and he just floored it out of nowhere, and then turned the curve, right, and then kept on going. They made you go out back of his barn, all the way out in the woods. He had cars from every year you could name, 70s and up.
When we first started doing counseling, we used to color cars and just did a ton of coloring sheets. And then we moved into the model cars. But really the coloring sheets was what started the passion, or when I saw Chris's passion for cars.
All right, Chris, thank you. If I understand that right, it's time for lunch.
Right.
Yeah.
You have a good day.
Thank you, too. Thanks, Chris.
Chris was referred to our program almost 13 years ago. At that point, he was engaging in some pretty significant behaviors out in his school district program, including aggression, elopement, and self-injurious behavior. The more we got to know Chris, the better we understood his passion for cars and the automotive industry.
Here at Upstate Caring Partners, we have something called a PAYS lab that allows us to work on vocational skills with our students here to build upon their interests, so that way one day they are able to take them into a workplace.
The PAYS lab really focuses on two areas for our students when they enter that lab: interest, or what do they enjoy, and aptitude, what are they good at. As Chris progressed through our program, we realized that he had the capacity to be successful in an auto shop. And luckily, we were able to pursue an internship at Master Vito Hyundai here in Utica.
Chris is very curious when he's here about just all of the different jobs that are happening throughout the shop. He'll go through each technician and see what they're doing, why they're doing it, you know, what kind of car it is, what motor it is, what size you're using on different bolts. He loves to just learn all of the parts of the vehicle.
Chris has the ability to stay focused on a job, which really is important to efficiency in a shop, and his strong focus and effort, I think, will allow him to maximize his efficiencies in the future. You know, everyone brings a little bit something different to the table,
that helps us understand each other a little bit more, and it helps us grow as an organization and as a team.
Chris is getting close to graduating. Our hope is he continues down this amazing path that he's been on to work in the automotive industry. What we found is that is really his HRE. That's what makes him happy, relaxed, and engaged. He knows what his passion is, and he knows the type of community that he wants to be around when he's in the workplace. We see this as a career that he can continue to grow in and continue to feel pride around and really enjoy this aspect of his life.
Yeah, your name is Connor Brown.
Connor was my first son, greatly anticipated. So excited to be a mom. He was perfect. Full-term baby, no complications.
You go down the slide.
He hit all of his early milestones. Connor was walking when he was 9 months old. He was sitting when he was 5 months old. But there were things that were very disturbing. His eye contact. You know, he didn't lock eyes. He didn't babble. As he grew, as his body grew stronger, the behaviors grew more disruptive. The damage became more intense. By the time he was 7 or 8 years old, windows started to break. His hair pulls became damaging rather than just painful. As he hit puberty, it became dangerous. It became dangerous for the other children in the family. I knew that I wanted to cure this. I wanted to make it better. I really thought that I could be that mom that would fix it, that within a few years, all these unusual behaviors would be gone. He would be in 1st or 2nd grade, indistinguishable from his peers. And that wasn't necessarily the case.
I oversee a team of behavior analysts providing behavior analytic support and services through an essential skills teaching model across 32 residences and 5 day habilitation sites. Historically, there has been a big step down in services from the school age division over to adult services. And the reasons for that are legislation, funding, and various supports that are just more richly provided within the school age divisions. What we're doing is trying to build out a team and do things a little bit different here at Upstate Caring Partners, in which we have a highly trained behavior analytic team that's ready to carry the skills that the people we support have developed in their school age experience and then carry them forward. Connor's in the unique position because he was able to catch this shift that we experienced as an agency early on. We do make an emphasis of a happy, relaxed, and engaged environment, and Connor has definitely enjoyed and benefited from a really committed staff group at his residence who took that seriously. Locally and across the nation, there needs to be more investment in adult services. There are many people like Connor, but maybe they didn't experience that seamless transition between the school and into adult programming. Without programs like ours, people are often either found on wait lists or they just go back home after school age services, which leads to the occasion for skill regression, which can be very challenging for families and the people we support.
When I think from where we started and where we are now, it's unbelievable. My son is 10 minutes away. He has a beautiful new home. He has roommates that they go out into the community. He has a fantastic social life. Ultimately, as a mom, what you want is your children to be happy. I think regardless of their career, where they live, where they go in this world, you want them to be happy. Connor's happy.
Individuals with acute intellectual and developmental disabilities and complex behavioral needs encounter significant challenges in accessing services. Many are denied admissions to psychiatric hospitals, leading to a cycle of repeated visits to the emergency department. This is often one of the challenges with working with individuals with more severe forms of autism, is it's not always quite clear why they engage in those challenging behaviors. Could be to get something, could be to get away from something, and could be due to some underlying medical issues that we don't quite understand.
So my name's Anne Marie Walker-Chiz, and I serve as the president and CEO of Rome Health. And I would say in an overview as the president and CEO of a healthcare system is to design healthcare services based on what the community's needs are. Taking care of persons with disabilities and maybe even severe disabilities within the healthcare network as a whole is commonplace, and I think has been for a number of years. The challenge today really is that the amount of needs are rising. We have an expectation that we provide quality healthcare with compassion, and so when there's really kind of a comprehensive acute need going on, very, very challenging within the healthcare network to meet all those needs and be able to create a safe discharge plan. I think the way through that at a local level is continuing to build relationships with everyone that's serving the community like we did with UCP. I mean, that was just ultimately for me as a CEO a changing point, and that relationships can be continued to be built, and they can change based on what our patients in the community need. So we want to make sure that we're continuing to redesign our healthcare system to meet the physical, social, emotional, and behavioral needs of the patients that we serve in this region.
Upstate is one of those places that to me is leading the way in a humane, dignified, we like to say televisable approach to folks with complex needs. It's a group that's a pioneer. They have led in the implementation of evidence-based practice, but under real-world conditions. What's happening here between FTF and UCP is a true collaboration. I mean, at FTF, we're researchers. We've developed some technology, but understand to get that technology into the hands of the people that need it, we need true collaborators that will be vulnerable enough to bring us in, let us see their toughest situations, but also strong enough to teach us when it doesn't work and how it needs to be modified. So that's what we have going on between FTF and UCP, is we have a true collaboration.
Certainly the medical field needs to have a better understanding of individuals with more profound and severe forms of intellectual and developmental disabilities. At Upstate Caring Partners, we work on understanding the individual fully, including possible underlying medical conditions as part of our normal assessments. And the second thing that we do is just crucial, is that we work on essential skills that are going to assist them in communicating out their needs better so that we can provide support around that.
To me, ABA is going to be compassionate care in 5 years. I mean, that's where we're moving. It's not where compassionate care is going to be. Compassionate care is here. Compassion just means make sure everybody is showing concern for the learner in the moment, every moment. That's it. That's the future. That folks with intellectual disabilities are always receiving compassionate care. It's not reserved for any particular diagnosis. We're going to learn about what they care about, what's hard for them. We're going to bring the joy, we're going to empower them, then we're going to teach them skills. And it's not perfect, and it's still hard work, but every year they are becoming more and more expert in these procedures, and kids are leading happier lives every year because of their efforts.
There are no universal solutions to these challenges, but our model, when intensively applied, has brought progress. Our collaboration with capable and compassionate partners like Rome Health indicates a way forward.
Early on in my tenure, I was amazed at the progress some of the individuals were having in our children's programs and wanted to learn more about it. Although we had limited clinical resources at the time, seeing the change in some of the kids we supported was undeniable. The UCP clinical team, led by Dr. Eric Jacobson, and our leading consultant, Dr. Hanley, were presenting our children's model at a local college, and thankfully in layman's terms that I could understand. At the end of the presentation, I challenged our team with a simple question. If we can do this with kids, can we do this with the adults in our programs that have moderate to severe disabilities? Since that time, our clinical team continues to make great progress with children and adults. Under the leadership of Dr. Eric Jacobson and Dr. Mara Vanderzel, we have made significant investments in our clinical program. We now have one of the best and largest groups of Board Certified Behavioral Analysts in the state. And some of the early results for adults are just as promising as those for the children we support. The switch to this improved clinical model has been challenging, and by no means do we feel that we've arrived. There has been and will be continued learning along the way. As in any evidence-based practice, the hope is what we learn will help inform our clinical practices and improve outcomes for the people we support. In that vein, we are committed to sharing this learning and progress with others so the field can benefit from our experiences. There still is remarkably little research available for those that present with the most challenging disabilities. The reality is that robust clinical models are expensive to deliver, but we are committed to seeking resources so that we can sustain the great progress and share it with others. We face significant challenges through COVID and continue to feel the effects of the staffing crisis. However, the success you see with individuals gaining greater independence and joy in their lives have been life-changing. Through sharing resources and successes with partners in the community, such as hospitals and other caregiving organizations, our team and approach has proven its value. All of this gives me great hope for the future and even greater excitement and commitment for what more we can accomplish, and most importantly, what the people we support can accomplish.